Hey, Will, you want me to call the roll?
Yeah, I'm ready to open the meeting. Before we do that, Jesse wants to go over some things. You ready, Jesse?
Yep. All right, welcome to our virtual meeting. We are going to cover a few basics before beginning. If you lose connection at any point during the meeting, you can You can reconnect by clicking the link or calling the number in your original email to members of city staff. Members, if you are able, please activate your video and keep it on for the duration of the meeting. Staff, if you are able, please activate your video when you are speaking. The chair, clerk, and technical facilitator are responsible for muting and unmuting committee members. Use the raise hand feature when you'd like to be recognized to speak, ask questions, or request a roll call vote. During any roll call, all panelists will be unmuted briefly. Staff, click raise hand when you are asked a question. The chair will do their best to call on committee members in order in which their hands are raised. Lowering your hand will take you out of the queue. Members of the public who have registered to speak. There aren't any on right now. I will read this off anyway. The name you entered in Zoom must match the name you are entered in registration. You will remain muted until called upon. The clerk will tell you when your time is up. After speaking, a member of the body may ask you a question. If you need to share documentation with the board, please send it to the email listed on today's agenda. Chair, the floor is yours.
Thank you. I'd like to call the meeting to order and ask for a roll call of members. Jim?
Jim's muted right now.
I can't hear it. Is he doing it separately?
He's muted.
Jim, you're muted right now. You should either have a prompt on your screen to unmute yourself, or you should be able to unmute yourself.
Can he unmute himself?
There is.
I keep unmuting myself and it keeps getting muted again. Okay. Alder Carter.
Present.
Alder Evers.
Present.
Greg Reed.
Present.
Soraya Dane.
Present.
Harry Strickland.
Present.
Elder Royce.
Present.
Claude Gilmore.
Present.
All present.
Okay, you have the agenda in front of you. You want to put it up, Jim? Okay. First order of business is the approval of the minutes from
Do this all at once.
all in,
Okay.
yeah. All in favor for the minutes being approved, say aye. Do we do the hand raise on that, Jim? I mean,
I can't see it when the agenda's up.
okay. Well, maybe we have to take the agenda off and somebody may have to read it to me because I don't have it in front of me. Let me pull it up on my other device. Make this a little smoother. Excuse me a second. Okay. All right, why don't you take the agenda off so we can do this correctly?
Claude, this is also where that unanimous, the line of where it would be considered unanimous.
Yes.
Yeah. And then we just get a first and a second on that with those.
Okay.
With the hands.
Okay, now we can do it. All unanimous for votes for the approval of the minutes. Just raise your hands.
On the screen.
On your screen. Yeah, raise your hands.
So, Claude, this is Adam. The way this will work for us is you would call you would ask the committee members if there are any objections to recording a unanimous vote.
Okay.
If there are no objections, then we record it as being unanimous.
Okay.
If there are any objections, then they would commissioners would raise their hand virtually. We can do it that way, or we can do a roll call vote for all motions. That's up to the discretion of the chair.
Members prefer raising hands or unanimous? Why don't we proceed with raising your hands? Go ahead. And then it can be
So the commissioners would need to do a verbal. If you were doing a roll call vote, the commissioners would unmute everyone, and Jim would call roll call.
Yeah, let's do that.
Okay.
Okay.
Are going to unmute everybody?
Okay. For approval of the minutes, Alder Carter.
Yes.
Alder Reed.
Yes.
Excuse me, Alder Evers.
Yes.
Kelder Roys. Mary Strickland. Speak, please. Please speak. You're not muted. You should be able to talk.
I was just unmuted. Aye. Mary's still muted.
Mary, you're unmuted.
Okay, yes, aye.
Okay. Soraya Dane.
Aye.
Have I missed anyone?
Myself, Claude Gilmore.
Claude Gilmore.
Aye.
All right, it is unanimous.
Okay, minutes are approved. Next item is, are there any communications? Nothing for communications from staff? Matt, anything? Wants to share before we go forward?
I don't have anything. Deb, sorry, were we sending an update in writing? So that already.
Okay.
Yeah, our update is in item number 12 in the update in housing operations.
Okay. All right. We'll come to that. Are there any public comments?
Can't hear you.
Where'd he go?
Can people hear me?
Yes.
Okay.
Your thumb is the all that we're seeing. There you go.
Oh, I'm sorry.
That's all right.
I didn't cover up my handsome face. I'm sorry about that. Are there any? I asked, were there any public comments? There were none. Any disclosures or recusals? Hearing none. First discussion item we have is item 60613, amending resolution 4332 and 4351 And then amending resolution 4381 relating to the Bomb Group LLC. Any comments from the staff before we proceed on the motion?
Change orders that the UW had requested for the space. So it involves, amending the lease, which are the first two resolutions, amending the contract with the Bowen Group, and then also amending the budget in connection with these change orders. So it's pretty straightforward. I know it looks pretty complicated. Since I submitted this resolution, the UW only wants to proceed with change order 1 and 2. They don't want to do change order 3. So this will all be documented in an amendment to the contract and an amendment to the lease that I'm preparing for Claude and Matt to sign and Kevin to review. So basically these incremental changes, as you may recall, the UW pays everything over the $20,000 allowance that the CDA gave them. So essentially they're paying for these incremental changes, but it's just documenting the appropriate contracts accordingly. And also amending the time frame, because the completion date is moving to July 10th. So everything got shifted.
Yeah, due to the COVID, I understand.
Yep.
Any other questions from the commissioners? If you have any questions, just raise your hand. If not, then by unanimous consent, hands raised. Alder Carter, go ahead.
Did we have a motion on this?
If we do the unanimous consent, if people don't have any questions, if you do want to do it by roll call,
I think we have to have a motion.
Move in second.
Yeah, move in second. Yeah, my apologies.
Okay.
Yeah, we need a motion for approval. Is there a motion?
So, Commissioner Gilmore, you've got some of the commissioners with their hands raised over in the participants.
Alder Calder's hand is raised, and Sarai Dan's hand. Is that a first motion and a second?
So I will move to approve this, and I believe that Greg Reed was a second, or he might be answering as Alder Reed now.
Yes.
Okay.
You can count that as a second. So it's been moved in second. Are there any questions? And by unanimous consent, all in favor?
So Commissioner Gilmore, you do have a hand up from Alder Evers.
Okay. Alder Evers, go ahead.
No, I'm lowering my hand. I was just trying to speak up. Alder Carter is correct. I think that we need two motions. And then I would suggest, rather than doing the roll call, just saying any objections. If you object to unanimous unanimous vote, then raise your hand. Otherwise, we just move forward.
I'm willing to adjust to that. So if there are no objections, we assume this motion is approved by unanimous consent. Okay. All right. Next item is the authorization of the signing of a contract for Parkside parking lot improvements. Any update from staff?
This is our property at Parkside Apartments located at 245 South Park Street. We put this project out for public bidding, received 3 bids back, and are awarding to the lowest qualified bidder, which is Wolf Paving. The project scope is to repave the parking lot. It's a large parking lot between the high-rise, the 8-story high-rise, and Asian Foods.
pretty straightforward.
Right.
Are there any questions from commissioners? Alder Carter, go ahead.
So, Christine, this is Parkside Asian Foods, and does it also encompass Brittingham on the face of East Washington?
No, it's only the parking lot. There's an entrance from West Washington and Park Street.
Okay.
Only the parking lot between Parkside and Asian Foods.
Okay. And we own the Asian food building, correct?
Correct.
Okay, thank you.
You're welcome.
Are there any other questions from commissioners? I'd like to have a motion and a second for this motion. Alder Carter, are you motioning?
Adoption.
Is there a second? Second by Sarai Dane and Mary Strickland. And I'll, hearing no further objections by unanimous consent, that this motion is approved. Okay. Next item we have is the authorization of the Community Development Authority to accept $195,353 of public housing funds related to COVID. That's 4385. Any background by staff?
These are funds that are calculated by the Department of Housing and Urban Development based on the previous 2 years of operating subsidy that the CDA has received. So they did a calculation and automatically allocated these funds to the CDA for purposes of preparing for and prevention and response to coronavirus. So this is in addition to our 2020 allocation of operating subfunds, and we are currently putting together a budget for use of these funds, but they could include things like disinfection supplies, transporting people for testing, and increased costs around COVID in our public housing properties.
Okay. Questions from commissioners? Alder Carter, go ahead.
Yes. So, Deborah, the CARES Act is a federal program.
Right.
And are we getting this through, is Dane County the lead? They're getting the money and then they distribute the money? Can you tell me how that works?
Sure. So these funds were actually appropriated directly to public housing or directly to HUD through the CARES Act. Okay. And HUD has then allocated these funds directly to the CDA. Okay. So this does not involve the county in any way. Okay. I'm sure that Dane County Housing Authority also received an allocation, but we're not connected to this resolution at all.
Wonderful. Well, not wonderful, right. In case Dane County's listening. But that's great that it was separate. Thank you.
I'm sure they got their own money.
Okay.
And Deborah, there'll be an updated budget on this, or an addendum to the current budget with the spending for this, or this will be handled separately?
So we have to track and report on these funds separately. So we'll be adding a line item into our budget or our financial reports in order to track this separately and report responsibly back to HUD on how we spent the funds. So we're setting up that structure within our financial software. So you'll see that probably on our the finance committee will probably see that in the second quarter financial reports.
Okay. Any further questions from commissioners? Alder Tagg, go ahead.
Yes, for Ms. Rakowski or anyone else who can answer, do we have a breakdown, an update on staff or residents at all our properties, whether if anybody's been infected, what kind of contact tracing is in place to be able to follow up on any potential infections or outbreaks. I'm just wondering if part of this resolution right now or separately in this meeting, we could get an update on that and perhaps make that a standing part of subsequent meetings, that we get a report of the impact on the virus on our residents and on our staff.
So that's covered in item 12, correct?
Right.
Oh, okay, well.
I can answer your question now and say that to date, we rely on residents to self-report that information. We, because of protected health information, aren't getting that data directly from the health department. But to date, residents who have self-reported, we have 1 out of all of our properties. And no staff have been infected.
Okay, but more detail would be brought forth in item 12.
Right, on our coronavirus response.
Okay. Alder Carter, go ahead. You're muted.
Thank you. As much as we want to have more and more details, we have to, as Deborah mentioned, PHI and HIPAA, all those regulations are to protect the individual, even though we might want to know more. So I want to proceed with caution on releasing that type of information. Thank you.
Okay, good, thank you. And then if there are no further objection, I was asked this to be approved by unanimous consent unless someone has an objection.
Commissioner Gilmore, I believe we
ahead.
Still need a motion as well.
Oh, there was a motion.
There hasn't been on this item yet.
I thought we had, sorry about that.
I know. We're all getting used to this new
I gotta get used to this new thing, yes.
Yeah.
Is there a motion to approve the this item 60578? Is there Alder Tag motion to approve? Mary Strickland a second, and Soraya Dane a second.
Motion to approve.
And Mary and Soraya a second. Okay. Then, hearing no further objection by unanimous consent, this motion will be approved. Okay, thank you. Next item is related to authorization of the CDA to accept $237,000, looks like $862 for housing voucher administrative fee funds related to COVID. Is there any background from staff?
This is we received these funds through appropriations under the CARES Act, similar to the previous resolution, but a different federal program. So these funds are for our housing choice voucher program, specifically administrative fees. We are expecting additional funding to come for our housing assistance payments and possibly project-based vouchers as well. And so this funding is specific to the administrative fees or the costs to administer the Section 8 program during the coronavirus pandemic.
Questions from commissioners? Go ahead, Soraya.
I have a question about the Section 8. Is that strictly on a needs basis so that people whose financial situation is the same, we can still expect to pay their own rent then? It isn't going to be a blanketed thing?
So these funds are actually just for, they don't impact the rent portion of the Section 8 program. They're really just to cover administrative costs. Things like increased costs to set up staff to telework, for example. So it's really around the costs of administering the program. But we are expecting future funding around the funding that you're talking about to help people whose rents have changed because of COVID.
Okay, so I guess what I'm hoping is that people that can still afford to pay their rent aren't getting any breaks on their rent. That the money isn't going to them. It won't be a blanketed thing.
Right. It's not blanketed, but every Section 8 voucher holder, if their income changes, especially during COVID, but at any time as a participant, they should request their rent to be changed. So we are still encouraging our voucher holders to do that, which then changes the amount of rent they pay.
Gotcha.
Yeah.
Okay, thank you. Thank you, Commissioner Alder Carter. Muted. Yeah. You're good, Alder Carter? You had a comment?
Oh, I just moved approval.
Okay. Is there a second? Commissioner Dane has seconded. No further questions. By unanimous consent, I assume this item to be approved. Okay, next item. This involves the statutory regulatory waivers for public housing voucher authorized during the CARES Act. Background from staff.
So as another part of the CARES Act, it allowed authority for HUD to waive certain federal regulations around the public housing and Section 8 programs. And as part of those waivers, HUD released a chart of all the waivers available to current federal statutes and regulations. And they asked housing authorities to determine which waivers they would accept and then keep a record of the waivers that we are accepting. The purpose of those waivers is to really allow it to be easier for housing authorities to serve residents during coronavirus. So things like allowing us to do virtual briefings, for example, or relaxing of regulations around how we do inspections. So it doesn't release us from the responsibility then. For example, if we're allowed to take a resident's word for the fact that their income is changing, which we want to be able to timely process income changes in order to impact rent. But then if, for example, after the corona pandemic is over, the housing authority is still responsible then to report accurate income even after the pandemic is over. So it doesn't fully release us from the regulations. It just is a waiver allowing us to continue to operate through the COVID pandemic. So the chart that's attached to this resolution lays out which, as a staff, we sat down and said, these are things that we really want to take. At any time in the future, we can still elect to take those waivers. It just requires us to document which ones we're currently taking.
So relationship to this is that means as long as we are under this pandemic until they get a vaccine or until the government says they've decided that we reached the next phase?
There's actually a date listed for each regulatory waiver that shows how long it lasts. So some last through July, some last through December. They're all listed in a column in the chart itself of when the waiver is over.
Do you have a date for this one? Are there a lot of different regulations that are connected with it?
There's a lot of regulations listed. So of the one I was talking about income changes?
Yes.
For that one, it's through July 31st.
So they might be revisited, or at that time they'll let us know whether it goes back to regular.
Unless Congress takes further action to release those waivers past that date, I would anticipate that it would only last through July 31st, unless there's an additional congressional action.
Okay, questions or comments from the commissioners? Is there a motion for approval? Commissioner Dane approval, seconded by Commissioner Royce.
And Commissioner Dane will need to make the verbal motion.
Commissioner Dane?
I move approval of this.
Second by Commissioner Royce.
Seconded.
Okay. And by unanimous consent, I assume this matter to be approved unless I hear otherwise. Okay, next item is the dissolution of insurance regarding a claim 819 with lots of zeros in front of it. Gregory Hamlich. This is standard. Any comments from staff? Not. A motion for approval? Alder Carter?
Yes, I move approval.
Commissioner Dane, are you second?
I move to second.
Okay. Been moved in second that this resolution be approved.
Commissioner Gilmore, you've gone on mute, I'm afraid.
Oh, sorry.
There you are.
Yeah. Alder Carter, you had a question?
No, I was just trying to get your attention.
Thank you. Thank you. I don't know how it went me on mute me. Okay. All right. The next item we have is the changing the standing board meeting date for discussion. Matt, you want to discuss that? Who's leading?
Yep. No, yeah. I'm unmuted now. Just took a second.
Okay.
So there's just two things on this. Obviously, the last Tuesday of the month is not our normal meeting date. This is partially, we've had to adjust some schedules because of the availability of tech facilitators and making sure that we're not overlapping with other city meetings. So we anticipate that this will go on for a while, that our normal meeting dates might not be available. So we're going to have to look at alternative times, and we can follow up with an email to you to get some feedback on this, but I just wanted to sort of bring that up. And then also Alder Carter, being a very busy person and busy running the city council, had some conflicts with the existing time anyways. So I just wanted to bring this up, that we're going to be looking at alternative times. If anyone has specific things that are going to times and dates that don't work because you have standing other meetings, you can feel free to send that to me, but we'll send you some communication for follow-up. I just wanted to bring this to light, that we'll continue to have monthly meetings, but it's most likely not going to be on a normal meeting date.
Okay. That's understandable. The next item is, any other discussion from the commissioners on this? You'll let us know by email and we can respond back and forth. Next item, update on housing operations security contract performance. Is that Deborah, you're going to do that? You're doing the screen.
Can you raise your hand?
Yep. I got it. Okay, so I provided a housing operations report as a narrative covering a couple different topics for this month. First was our COVID response. And just to summarize it for you, Since the last time we met, we have continued our decreased operations. We're still responding to residents and available, but our offices are still closed to the public. They remain closed to the public today as well. We're still checking in with residents who are considered vulnerable. We're calling people and making sure we're following up with people who might need extra or might have a higher impact from isolation, especially during stay-at-home orders. We're continuing to do apartment turns and do apartment showings. So we're right now troubleshooting a few ways to do digital showings, but we have continued to have move-ins during the pandemic. And our maintenance staff are still doing emergency only work orders, but they're also disinfecting our property 7 days a week. So right now we're looking at alternate ways to do disinfection at our properties in order to decrease the staff time it's taking. Primarily it's because our maintenance crew has been working 7 days a week since March 18th. And we're looking at alternate ways to be able to give some of our staff some respite going forward. Are there any questions about COVID and CDA's response or current state?
How are people doing with distancing?
Overall, I think people have adjusted at our properties like any apartment complex. The biggest impacts we've seen is an uptick in mental health concerns. So we're continuing to coordinate with Journey and our mental health providers to be able to address some of the concerns that we're seeing. But I think that's been the biggest impact on our residents is an impact on their mental health.
And you've been offering services?
We're not a mental health service provider, but we have been connecting people to Journey when necessary.
Okay. Another question I had to do with the, are you providing for people who might need access to any other things in terms of COVID? Like public health, are they coming into those buildings to help people, or are you directing them where to go?
We're directing people where to go. So we haven't restricted our buildings to visitors, but we are encouraging people. TAG was actually helpful in getting masks out to our Triangle residents and has recently come up with another donation for Romness. So that will help our residents be able to leave their apartment building safely and be in the public while wearing a face covering. So, but otherwise, we encourage residents, if they need to leave their apartments for any reason, to follow public health guidance and to be able to do it safely.
And there's no problem with people crowding parking lots with the recent sort of change in the some of the regulations.
We haven't seen an uptick in mass gatherings or crowds in any of our properties.
Okay, questions or comments from commissioners on this? Alder Tag?
Yeah, it was the District 13 Mask Brigade did make all the masks for everybody on the Triangle. All the Bayview residents and all the CDA residents on the Triangle now have a mask, and we're working on doing the same for Romness. So I let the director there know that we have 105 additional masks to drop off. I didn't know if she needed all those or not, and so I'm waiting to hear back. But if they could use them all, I'm glad to drop those off. And if we can get a number as to how many we should keep pushing for, that'd be great. One other thing is that District 13 started a neighborhood alliance where all the different neighborhood associations are working together to reach out to anybody in need impacted by COVID. And we're doing what we're calling an essentials drive for folks on the Triangle, where not foodstuffs, but things like soap and, pantry type items that, folks may need. And we're going to do the same for Romness this will be in early June. we'll collect the items and drop them off, and then we're going to see if we can't do the same for Romney's.
Well, thank you very much for that, auto tag. That's wonderful that you did that. Is this a collective effort with someone willing to make the donation, or was this done sort of organically where folks all kind of came together?
Well, we sent. I used my automatic account to send a postcard to everybody in the district, asking for to create what we call the District 13 Cares. And we have representatives of all the different neighborhood associations who help coordinating it. And anybody who needs help can call a number or email a specific email address asking for help. And then we have a list now of 40 volunteers that are distributed throughout the district to be able to connect to folks who need help. So all of this was, the intention was, everybody was feeling pretty wigged out by the pandemic, and we try to focus that anxiety into how we can help each other. It's a good way to stay grounded and stay focused and stay in the moment, because none of us know what's going to happen in the future, but we know that helping each other out, loving each other, lending a hand is good for everybody, right? And so that's what we're doing.
Wonderful.
It is a group effort. It's marvelous how people have responded.
Wonderful. Alder Carter, you had a comment.
It's an overabundance of food that the residents at Romness used to walk over and pick up in their food pantry, and now they are not walking over there. So that might be something that TAG can work on as far as helping St. Mark's, which is in your district, TAG, to just get some of their food distributed instead of it just sitting there. The other thing I wanted to touch on, there are people who might not be able to wear a mask, anyone with respiratory issues. And so I wanted to know, Deborah, what has that been told to some of the residents? Because when we say we have a mask for everyone, someone who might be marginal might feel they have to wear one, even though they probably shouldn't. And with the temperature rising and the humidity going up, if you could see my hair, you would know what I'm talking about. That is something that we probably should let our tenants know, that we don't want to put their health in danger.
Definitely. So at the Triangle, TAG worked with the Triangle Neighborhood Organization, the TNO, which is a resident council at the Triangle made up of CDA residents. So they have been helping basically to distribute masks to people who request them. And so they're not distributing them based on and telling people that they're mandatory. We're not a health authority, but we do want to be able to make those resources available to residents who need them. So that's more the approach we're taking, instead of we're not enforcing face coverings or telling people it's mandatory they wear them. We're just telling them they should follow CDC guidance and doing the best thing for their health. Mm-hmm.
Yeah. Any Sarah Dane, go ahead.
I want to offer kudos to District 13 and TAG, and to the CDA in general for the regulations that have happened and for the helpful efforts being done. My friends that are in public housing are feeling safe because of the regulations, and have been, even though they don't like that it's happening, like none of us like that it's happening, they're glad for the thing. So I was glad to know that, and I'm really glad that we're doing all this, and I'm really glad that we've gotten them extra money to help administer all of this. So, and thanks for the hard work, all of you staff people and the alders. Thank you. That's
wonderful. All. Thank you, Commissioner Dane. Commissioner Strickland? Go ahead.
Okay. I think the tech people have to help us get this audio off and on faster because it's hard to get the audio going.
Yeah, you were muted on your end.
But I've been tapping it and it hasn't something. Yeah, anyway, is there a way, what TAG's doing is great. Is there a way we can replicate that, in other districts where we have, housing?
So the thing that's unique about the residents who live in TAG district is they're a higher percentage of elderly and disabled folks. So it really is meeting a higher risk population. It's something that I think we might be able to replicate for other housing. But just a side note, that some of our scattered sites and TRUACs are primarily families. So not saying that they don't need masks, but it's just it's been helpful to be able to prioritize higher risk residents.
I think that's a good point. Question I had is, I know that there's been a big concern about the African American community and testing, and that they were offering free testing at the Alliance Center. Is that still offered, and have people from the South Side been able to take advantage of that?
I can speak to the fact that I know that testing is still continuing. I can't say whether or not people on the South Side have been taking advantage of it. To my knowledge, it's been really well utilized. Unless other staff want to jump in.
Yeah, Commissioner Strickland, go ahead.
No, I'm done.
Oh. Alder Carter?
That a lot of people in South Madison has taken advantage of it. I think that we probably need to go into the next phase, the next phase of testing, which would probably have it switch to another location. I think the reality is, not to be a Debbie Downer, not to talk about your name, Deborah, but not to be a Debbie Downer, is the fact that COVID-19 is going to be here. It is not something that's going to go away at the end of the year. So we really need to look long range and not short range on this. I think that COVID-19 is going to be similar to the flu. How do we protect ourselves against it? And so I think there needs to be a lot more discussion on how we live with COVID-19.
I think you make a very good point. That's something very important that we're going to have to all adjust to. Alder Tag, go ahead.
Yeah, a question. Are we providing transportation to any of our residents who want to get tested?
We haven't been to date. Our funding now allows us to do that. So we could organize transportation for that. It's something that we talked through in our discussions about how to use the funds, but a lot of our residents utilize current transportation options available, and it hasn't actually been a huge demand from our residents. So we would want to make sure that if we're providing it, it's actually meeting a need. So we haven't actually been providing it, but we have talked about it.
Matt, go ahead.
So public health is actually arranging all of that. So if someone needs a free ride to the site, there's a hotline that they call, and public health helps arrange for that free ride. So that's not going to be on the CDA side.
Commissioner Strickland, you had your hand up.
Yeah, I wanted to ask Deb if there's, we're talking about transportation. What about internet access? Has it been discussed that we should have try to get internet access to the residents, especially during a time like this?
Definitely. I've actually spent a lot of time working on that exact issue, and it's a update further down in my update. So that actually falls underneath the Connect Home project. Specific to COVID, we just submitted a grant application with the East Madison Community Center to the Public Service Commission for funding to provide internet service to all of our Truex residents. That application deadline was today. We also received approval from AmeriCorps Vista to hire a volunteer who will begin working on internet connection starting hopefully in July, possibly August. And so I just received that approval today. But we also did a demo on data-enabled tablets and hotspots for residents through one of the Connect Home stakeholders. And we tested them at multiple properties around the city to see how effective they were. And we're putting together an order for those devices to be able to hand out to residents. So the Madison School District has been really helpful in getting hotspots out to some of our residents who have kids who need to be able to do their homework. So they've been really crucial for that. Where we're able to really look at the gap is people who don't have children and now don't have access to the internet through our computer labs because they're closed. So we're trying to provide devices or hotspots to those residents. We also got a donation, or East Madison Community Center just got a donation for 50 laptop computers. And so we're going to be creating a lending library to lend those devices out to residents at the Truex property. Kind of put a lot of time into the Truex property, especially because that's where the most families live. So really making sure that the children at that property are able to connect to the internet for their homework. And so we've put our most effort there. But as far as ordering devices, that property, we're looking at Romness and the Triangle.
Matt, go ahead. Oh, you had your hand up. Commissioner Strickland?
Okay, no, that's it.
Okay. That's a very good update. I appreciate that, Deb.
Another update for that is the CDA received, or the city allocated funding for a feasibility study for CDA housing residents. That feasibility study is consists of a survey and then a strategic plan in order to provide internet. So it's a baseline survey of how many of our residents are currently connected to the internet and how. And that is due to begin in June. So next month, we'll be sending out a survey to all of our residents to collect that data. And then we'll be rolling out better data collection into our annual recertification interviews. And so we're planning to roll that out to track our outcomes as far as how many people are actually getting connected through the work that we're doing.
Okay.
Do we have an idea what percent of residents have internet access, Deb?
Well, we don't have actual data on our residents. The data that we get from HUD is that on average, about 30% of HUD-assisted households are connected. Another 30% are underconnected or don't have actual internet in their home, are using a cell phone or another device. They're sharing internet. And then about a little over 30% are unconnected.
Yeah, I think that there's a tendency for a lot of people to share in households where there's more than one. So it is not a clean thing, but having the broadband access, even if it's enough megabytes, so people can get on and do some things will make a big difference. And so getting people to underwrite, hey, I give you 15, 20, enough for them for a family to use, versus of assuming they have this access, which a lot of them do not.
Right.
Yeah, and my understanding is that nationwide, larger cities than Madison are providing devices and high-speed access to all of their residents. So we should be, with the focus on our technology infrastructure and technology sector here, we should be able to get some donations and be able to make this happen in Madison, given the nature of our industry here.
Yeah, that's exactly the Connect Home initiative. So Madison was awarded as a Connect Home agency in September of last year, and we we're on a group with the city information technology department. So we're working together to be able to provide internet service, but focusing on CDA residents and hoping that it will impact other low-income residents in the city.
Okay. Any other updates, Deb?
I wanted to just mention the other categories I had in my monthly update were around public housing and multifamily housing. Our current occupancy rate is 97%. I've been taking a look at our revenue losses for rent collection, and for the month of April, they were down 4%. Which is a little less than I anticipated. So I'm going to keep tracking that number and see what our residents' incomes are doing during the COVID pandemic. We did see a larger impact on delinquencies. So in other words, and people seem to be still paying timely, but there's a larger percentage of people who aren't paying. So for that, we will be working on setting up repayment plans with people and sending out information to people that they still have to pay their rent or ask for a rent change based on their income change. So we're working on that communication out to tenants. We sent a mailing out last week. HUD developed a flyer that we use to send out to residents about rent payments. So we're still getting a lot of requests for income changes, and we're processing them as timely as we can. In the Section 8 program, we've seen our tenants' income from March to April decrease by 10%, meaning that the rent payments had a bigger impact in the Section 8 program. We also received additional allocation of mainstream, or not mainstream vouchers. We did actually, because of COVID, an additional 30% allocation in our mainstream program. And we received 30 tenant protection vouchers for the Oakwood Village project. So been working, still continuing, as I said, under COVID, our operations. And then under security, so our security contractor started on March 24th. We did a revised scope of services because they were starting in the middle of COVID. So we weren't able to do the resident meetings as we had hoped, but we are trying to put together a way to either do that virtually coming up soon, and we're doing a mailing out to residents to introduce our new security company. So they have been, we still did onboarding, and we're continuing to meet with them on a weekly basis. We also started using a new software application. It's a phone application, and this really streamlines our reporting and helps us to get better real-time data on some of the issues that we're seeing at the properties. We haven't seen an increase in calls for service. I think overall our security have been really just present at the property, and we haven't necessarily seen an increase in incidents.
Commissioner Strickland, go ahead.
Yeah, Deb and Adam, are we revising our budgets because of this? You talked about the rental decreases, rental income, et cetera. Do we have a COVID budget that we've done for the properties?
So we also received additional revenue and HUD allocated those funds to be able to use during COVID. So we're keeping an eye on it, and we haven't developed a separate budget, but we'll amend it as we get additional funding, and then continue to do projections on what we anticipate the year end to be.
So, I mean, you bring that update to the Finance Committee.
Yeah.
Yeah.
I mean, that's important. You know, every business is revising their budgets, and even if we're getting additional monies from HUD, we need to add that on the revenue line, and we need to decrease the rental income accordingly. So we should, particularly for our larger properties where it's going to have a bigger impact, we should do some revisions, it seems, to the budgets.
We've also seen a decrease in, right now anyway, for our maintenance expenses per unit, because we're not doing non-emergency work orders. But so I anticipate those expenses will go up later in the year. The expenses that we're seeing under maintenance costs are due to apartment turns and emergencies that have come up.
Yeah, that's understandable. Okay. Any other items for your report?
Unless anybody has any other questions.
No, I think that's good. Matt, a couple questions for you before we close. One had to do with future meetings, which you're going to update us on when that might be. But we had talked about the finance committee having a separate meeting, and then us having that special meeting. So all that has to go through the mayor. You had talked about the finance committee. Do we have a confirmation on the date yet, or approval yet to move forward?
So I have not gotten a date confirmed from the mayor's office on that. Adam, I don't know if you've heard anything.
Yeah, I can speak a little to that. With so for this meeting, we're required and fortunate to have our tech facilitators with us to help make sure that we can run the meeting, particularly when we get public comment, which we don't get a lot of it, but if we did have a number of people who wanted to join, we really need that technical facilitation to help make sure that we're following open meetings laws, that we're getting everyone through. For the CDA for the finance subcommittee, we're looking at getting trained and being part of an initial pilot that we would run that staff would be able to run that so we could do the meeting, so that we could run the meeting and schedule it as we needed to. So we're still working on, they've got training dates that are upcoming. So after we get trained on how to run all of the details, then we can get something scheduled.
Yeah, we appreciate you sending out those reports, and we can review those in advance and sort of keep moving forward. But we obviously need to have an official meeting to make a review to bring things back to the board. And then the other question, Matt, was having that special meeting we had wanted to do, that also is on hold. Do you think that might be something in the future?
I think that the question is, will we be able to do it ourselves, or do we need tech facilitation? In which case we have to get it on that longer term schedule. But I think if we can do it ourselves, it would be similar to the finance committee, where we can set it, then we'll poll people to get the timeline.
Yeah, if we can arrange the logistics of it, it would be good for us to have that. We'll obviously do that virtually. Question I had about the regulation, since today was the end of the city's, or did they extend the stay beyond the day's date of the 26th?
So we're officially in phase 1 of the reopening.
Okay.
But the city itself, our buildings are mostly closed to the public. We're also working remotely.
Yes, no real change.
Yeah, no real change for us operationally. Yeah.
Okay. Any other items for the body?
I just want to congratulate Sherry Carter for being elected president of the City Council. Nice press this morning.
Oh, you muted. Yeah.
The other thing I just want to note is that our hiring, all of our CDA hirings, including hiring for our housing development person, were subject to the citywide hiring freeze. So we have, we're working through with the mayor's office and HR to try to unfreeze some of those positions, but that affects a number of our positions are open at this point and unable to be filled because of the hiring freeze.
And that looks like it won't be resolved too soon? Last week we had to fill out some specialized forms to make the case as to why these positions are necessary for COVID, for essential operations, because of how they sort of work budgetarily. And we have not received feedback yet as to whether or not they will be unfrozen. Okay.
More information is needed. Yep.
And again, also congratulations, Alder Carter, Madam President. Any other items before I have a motion to adjourn? If not, I'll entertain a motion to adjourn. Motion by Alder Evers. Is there a second?
Adjourn. Motion to adjourn.
Is there a second? I just need one. Thanks, Alder Carter. And
Second.
And Commissioner Strickland. All right, we have a motion on the floor and a second. And by unanimous consent, I consider this meeting to be adjourned. And thank you all for joining. And I think we got through this pretty decently. Thanks to the technical staff for their esteemed training and helping us through this.
Thank you, everyone. Have a safe evening.
Good night.
Take care. All right. Bye.